Welcome back to the Paws and Effect podcast with Dr. Nicky. Thank you, Nicky. Thanks for part one. Very informative. Really appreciate that. So I would like to dive into the topic of wellness and preventative healthcare. So I know this is something that a lot of practices are offering as clinics, often run by nurses. And I think that's a great opportunity for pet owners to come in and visit, whether it's just to have a checkup and have a little vet visit, but also to discuss any concerns. So one of the things that we offer are our dental clinics.
Yes.
Can we have a little chat about dental and oral health and the importance of it?
Yeah, absolutely. It's so important, particularly as dogs get older, and not necessarily only older dogs. I mean, we all know certain breeds are predisposed to dental disease. Dachshunds, Maltese poodles, Yorkies particularly. You know, I often joke that I can have a 12-year-old Jack Russell who has never had a dental in its life and has much better teeth than a 4-year-old Dachshund. So there are certain breeds that are predisposed to it, and I try and cover that in a vaccination as well when the dog is young and say, look, just be aware that we are going to have to be more proactive about dental health in this breed. And so the dental clinics are a really useful way to get people, feet in the door so that they can, because a lot of people just aren't aware of it. Nobody really opens their dog's mouths kind of thing. And
it's unrealistic to ask them to brush their teeth on a daily basis. There are very few owners who do that.
No, absolutely.
Have you come across any recently?
No. I mean, I barely remember to brush my own teeth twice a day. I'm certainly not going to brush my dog's teeth twice a day. It's not realistic. Our society is just too busy.
Yeah.
So, and a lot of people will look at the front teeth and like the incisors and the canines, and they're not so bad. And then, when I lift the lip and I look at the back teeth, they're like, oh my gosh, that's terrible. So, they're often just not aware. So these dental clinics are a way of, making people aware. And a lot of people don't know that their dog actually does need to have a dental done. And it's much easier to have a dog in when there's just a small amount of tartar on the teeth, and then it's a quick anesthetic. Because unfortunately, obviously in pets, they have to all have an anesthetic.
And why is that? Explain to us.
Well, for many reasons. We need to. It's not like you can tell a person to sit still and not bite you when you have your hands in their mouth looking at things. So they have to be asleep for it. And we often have to scale the tartar off and then see what
that uses a lot of water as well. So you've got to protect airways.
Exactly. So they have to have a tube down the airway to make sure that they don't aspirate any of that. And then we take the tartar off and then see what the tooth is like underneath. And, sometimes they look absolutely fine and great. Then we don't, and that's the end of the story. But a lot of the time we have to extract teeth. And if we're more proactive about our dental care and they come in more regularly and start coming in earlier, then we don't have to take out so many teeth. I mean, last week I think I took 17 teeth out of a dog's mouth just because they were all completely rotten. And I always try and say to people, think about if you've ever had toothache. Now try and think of having toothache in 17 teeth. It's a big cause for, pain and unnecessary distress for an animal. And unfortunately, unfortunately for us, they are so much more hardcore in terms of showing pain. They just don't show pain like we do. They feel it just the same. They've got the same pain receptors. Everything is the same, but they're just hardwired to not show that pain. So, the only time I've ever had an owner go, I think there might be a problem with his teeth, is if literally the one half of the mouth is so rotten that the dog just eats on the other side of the mouth because they literally can't have any food there. And then eventually they'll go off their food completely.
So subtle signs, so you spoke about, chewing on one side, possibly salivating.
Yeah.
Worst case, if there's
stinky breath,
an abscess, a halitosis.
Yeah, and if there's an abscess of the carnassial tooth here at the back, which is the main crushing tooth, you'll often get like a swelling underneath the eye. And so people come in thinking it's a cancer or some sort of growth, and you're like, no, it just needs a dental, and it's easily fixable, and it provides instant relief for the animal which is great.
Absolutely. And what impacts, other than a breed, what are the things that you can advise early on in these dental clinics that people can do to try and avoid or certainly delay dentals?
Well, I mean, there's various things. I mean, you can put certain solutions into the water, marketed veterinary products that get put into the water, which is basically like a Listerine type of effect on the teeth to reduce plaque. I actually had a client another day saying they've tried to brush the dog's teeth and they hated the toothpaste. I said, well, then just get rid of the toothpaste. I said, if they tolerate the brush, that's like 90% of the work anyway.
Absolutely.
It's the abrasive action that does everything. Yeah. And then there's also certain diets, that are formulated for dental health. The kibbles are a lot bigger and are designed to only break once like 90% of the tooth has gone through it. So that chewing action actually abrades the surface of the tooth and gets rid of the plaque, which, if we don't get rid of the plaque calcifies to tartar. So that's also great. And you can use that almost as a treat. So it doesn't have to be the dog's sole food. They can be on their normal food and then be given this dental diet as an adjunct for the day. And a lot of dogs love it. So, that's something. And that's a lot easier than sitting there with a toothbrush and brushing a dog's teeth.
And obviously a lot of people go like, oh, my dog's teeth are great because I feed them bones. We spoke about the risk of feeding bones in our part 1.
Yes.
What are the other things that can feed that might?
So
are there treats that are recommended?
There's like rawhide chews and all those kinds of things that basically sold at the front of house of pretty much every veterinary practice. But that can be a bit of a double-edged sword. I say to people, if your dog is one of those dogs that literally just sits there and like munches and doesn't do anything with the hoof other than just chew on it, that's great. But I know my own dog, she would like chew, like bite pieces off. So I'd get to I'd see when the hoof was a certain size, and then I'd have to take it away because otherwise she'd swallow bits, and that creates all sorts of drama.
So with owners wanting to reward their pets, whether it's because they're going to work or because they're trying to train them, one of the things we're facing, I know as vets, is our overweight pets. So I know one of our other wellness clinics is our weight clinic.
Yes.
Let's talk about overweight pets. And it's obviously a bit of a tricky subject.
It's always a tricky subject
to bring up.
Yes.
Yeah. How do you broach it?
Well, I'll often make a little joke about it, and I'll say, we're looking a little bit round around the edges, and then I'll talk to the dog and say, it's okay, so am I. So, because often people will get quite annoyed if you start saying their dog is overweight and it's coming from someone who could also do with losing a few pounds. So I always make a little joke about it to kind of exactly. It just sort of takes the focus off. It makes them feel a little bit more at ease and like they're being judged less.
So how do you judge weight? I mean, we have charts that we use in order to...
people are often like, they come in with a dog and they're like, is it the right weight? And I'm like, I don't really go so much on weight. It's more about body condition score. So there are various charts available showing what you want to see in a dog. And I always like it. I mean, the charts are quite varied, and it goes up to from 0 to 9, which is often too much for people to kind of take in. So I'll say to them, look, when the dog is standing up, you want to see chest, and then it needs to narrow down to a waistline, and then obviously, the hips. So if you see that, that's great. And then obviously from the side, you want to see chest, and then, abdomen tucking up to the flank area just before the legs. So, and then also having a feel of the ribs. So you want to be able to feel each rib, run your fingers over them, but you don't want them to be too prominent. But you also want to be able to feel them and not have such a
layer.
Big covering. And the same goes for the spinous processes on the back as well. So you want to be able to feel each individual one, but it mustn't be too prominent, and it obviously must still be palpable.
Absolutely. And what are the concerns with overweight pets? I mean, we're not doing it because we're worried about them aesthetically necessarily.
No.
They don't have to worry about self-esteem. But why do we advise that owners keep their pets in optimal body weight?
There's certain diseases that are much more prevalent in overweight animals, certainly from taking cats, for example. Diabetes is a big one.
Yeah.
Pancreatitis is another one. And, these diseases are heavily intensive in terms of long-term management. And, it's a lot to take on. So if you can prevent them, it's a lot easier. And then with dogs, same story. But also arthritis is such a big issue, particularly in our older population. We've got, as I said earlier, we've got these animals that we're trying to get to live to 12, 13, 14. And the more weight they're carrying, the more likely they are to suffer from arthritis.
So it's more pressure on the joints and
exactly. Also things like,
mobility.
And it's not even restricted to old animals. I mean, if you've got a very overweight Labrador who's 3, they're more likely to rupture a cruciate ligament than an animal who's not. I mean, obviously there's other factors and anatomy and all that kind of thing. But, it's not just the older patients, it's the young patients too. And unfortunately, arthritis is something that is so prevalent in all of animals. And it's actually vastly underdiagnosed in cats because, cats are big sleepers. And so they just tend to spend most of the time kind of sleeping. And as they get older and they get more sore, they just sort of sleep more. And so I'll often ask clients, where do you feed your cat? Is it up on a counter, or and how does your cat go out for to use the toilet outside? Do they jump through a window or doggy door, whatever? And they'll say, he used to jump through the window and now he doesn't anymore and he waits for me at the door. And I'll be like, well, that's a really big hint that, something's wrong and he doesn't want to jump. And so, you have a feel and, the cat is really, really painful when you try and extend those hips.
So often the weight is relating to, or you're seeing it as signs of pain.
Exactly.
So your general advice for managing weight-related issues, how do you... I mean, it's not like you can exercise your cats or take them for a run. So let's talk cats first and then...
Okay. Well, a lot of the time it comes down to diet and what you're feeding. And unfortunately, cats a lot of people treat them as grazers. And a lot of cats will only graze. The problem with that, though, is especially if you've got a multi-cat household, you might have one cat who eats like a bird, for want of a better term, and the other cat who just mows down whatever's there. And if there's constantly food available, then that cat's just going to keep going.
Sounds like my house. So what do I do, Dr. Nicky? Tell me. I've got one chunky cat and one really skinny cat. And what do you do in that situation? How do I keep the chunky cat away from the food?
Well, that is a tricky one. You can, depending on, it's all down to dynamics as well. Like, are the cats okay being fed in separate rooms? Do they need to be, cats generally are solitary creatures and we make them live in multi-cat households for our sake. And often if you get two kittens together, then they love each other and everything's fine. But when you start bringing in new kittens to established adult cats, it can get a bit hairy. So often they quite appreciate being fed separately, so they're not being fussed. And then you do get certain foods that you can, it's either a calorie restricted diet or it changes their metabolism, and you can feed the same food to both cats but just different amounts. But then obviously you'd have to kind of police that a bit so that they're not just tucking in. But yeah, the weight clinics are great. And I mean, I've seen such a big change in a number of patients where they've lost the weight and the owner's like, oh, he's like a puppy again. He's just, even though the dog is 10, he's racing around like a lunatic because, he's just got so much more energy and there's less pressure on those joints. So he's not as sore. So it does have a big impact in their day-to-day quality of life.
So you're talking older pets, and that's obviously particularly a time when we're seeing slightly overweight pets due to change in metabolism and possibly energy levels. Let's talk about our geriatric patients, because that's the other clinic that we offer within our practice.
And a lot of other practices run.
Yes.
But it's an important one because
We're going to take a break. Thank you for your attention. This podcast is sponsored by UltraPet, so I'm going to take a moment to read you their manifesto. For more than 25 years, we at UltraPet have made it our mission to take the ifs, buts, and maybes out of premium pet food. Because when we say scientifically formulated, it's a fact. When we say value, the numbers speak for themselves. When we say more meat, the proof is in the pudding. And when we say we care, our accident cover delivers. What sets us apart is not one thing, it's all the things combined. Because we understand that when it comes to your pets, you want certainty on all fronts. You want absolutes, the absolute best, given your means. Premium quality, but without the exorbitant cost. So, rest assured that any claim we make, we stand by. It's our commitment to your pets, our promise to you. And to prove it, we're willing to put our money where our mouth is. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
Vaccinations, it's one of the reasons that we recommend that they come in every year so that we can pick up problems, and that's really important. But these geriatric clinics, they'll come in and often people will bring an animal in because they're like, oh, there's a lump on his leg or whatever, and they'll come in for that, and we'll examine the dog and we'll go, yes, okay, the lump, and we need to deal with that. And we normally do what we call a fine needle aspirate. So we take a little sample of the lump with a needle and syringe and look under the microscope and go, okay, this is just a fatty lump and we can leave it alone, a lipoma, or no, this looks dodgy.
Sinister.
Yeah, we need to get this out. So they might come in for that, and we'll obviously address that issue because that's the primary complaint. But while they're there, we'll be like, okay, well, we saw him 8 months ago, and he was 4 kilos heavier then. Have you changed? I mean, has that been a conscious decision? Have you put him on a lower calorie food, or have you restricted his food? No, we haven't done any of that. And then you're like, okay, well, that's not normal. So then you say, okay, well, have you noticed that he's been drinking more? Oh yeah, I'm having to fill up the water bowl a lot more than I used to. And then that all comes out, and a lot of the time people know all this stuff, like it's there, but it hasn't kind of been brought to the forefront. So
they haven't known how to handle it.
Exactly.
Yeah.
With us having these clinics, geriatric clinics or weight clinics or whatever, we often just prompt them. We ask the right questions, and they're like, yeah, no, absolutely, I have noticed that. And then we can say, okay, well, in these cases, we would really recommend doing some blood tests because it could be diabetes, it could be kidney disease, there could be a whole bunch of things going on.
And early detection is obviously critical.
Absolutely. If the earlier you pick it up, the more treatable it is generally.
And so we provide support in terms of managing those things and working with owners to best support them and their pets.
Yes, exactly.
Yeah. So I know that you have a few long-standing patients that you're very fond of.
Yes.
And obviously being part of their journey is really special. One of the things obviously with geriatrics is that we have to ultimately sometimes say goodbye, whether it's when we are ready or not. Let's talk about euthanasia. How do you support your clients and your patients through the process?
Well, I think a lot of the time you've got to identify which patients are candidates for it and which are not, which from my perspective is generally very easy to do because I'm objective and I know what to look for and so on. But obviously from an owner's perspective, it's incredibly difficult. This pet has been part of their life for 10, 12 years and very much loved member of the family. And they're like, okay, well, how do I know when it's time? And it's a question I get asked all the time, and it's not a straightforward answer, unfortunately. It's a tricky one to tackle, but it's such an important question to ask. And I feel like people asking that question is already half the battle, because the fact that it's kind of in their consciousness means that they really think that they might be getting to that
They're
time.
recognizing quality of life.
They're recognizing signs, but they need guidance as to when to call it a day. So I often say to people, I go on obviously lots of criteria, but two easily discernible characteristics would be if the dog has always, for example, the dog has always been an excellent eater, mows down everything you put in front of it, and now it's like getting pickier with its food, and it's kind of like half finishing its food, and just not doesn't have that same enthusiasm to go and eat. That's one. But the more important one for me is behaviorally. So if they've always been a dog or a cat that wants to be with you all the time, like follows you around, your shadow the whole time, and wants to be in the mix, and now when you get home from work, they don't get up to greet you, and they kind of just spend most of their time sort of taking themselves away from the family. That's a big one for me. And in fact, in my own pet's case, my dad's dog, we'd been battling with renal disease with her for probably 2.5, almost 3 years. So early diagnosed, got onto the right medication, the right food, and she did really, really well. But then obviously towards the end, we were doing something called subcutaneous fluids. So, to try and rehydrate the animal, and something that people can do at home. We're happy to teach them how to do it. Put the fluids under the skin, and that, sort of helps them along. And in the beginning, she tolerated that really well. But then it got to the point where every time we did it, it was stressful for her, and it was stressful for my dad. And so I was like, okay, well, let's just leave it, because it wasn't worth the stress.
No.
And then the one day he phoned me and he said, and she was always like under your feet, needed to be in the mix all the time. And the one day he phoned me and he said, I couldn't find her, and I looked for her for ages, and it was pouring with rain, and she was under a bush in the pouring rain. I said, I'm coming now.
Now's the time.
Now is the time. So changes of behavior like that, like always wanting to be around, and then isolating and
particularly in the rain,
hiding around a bush for me and in the rain is like, that's a given.
So one of the things, I agree with you that behavioral change, particularly the urinating or defecating in the house, and I think a lot of people feel guilty because they go, is this inconvenient for me? Am I making the decision because this is a real inconvenience?
I'm having to clean up all the time.
I'm having to clean up, and but for me, that's behaviorally, that's not how they would behave, and it's distressing for them as much as it is for you. So for me, those sort of subtle changes as well, that people often are just so concerned about making these decisions around.
And I often say to them as well, I mean, I'll say to them, I can clinically examine the animal and I can list all the problems that we're dealing with, and those on their own would often be enough to make the decision. But I'll say to them, think about what he or she does for most of the day now, and then think about what their day is consisted of 3 months ago or 6 months ago. Is there a big difference? Were they chasing monkeys like crazy and super active and part of the family, and now they're just miserable and sleeping in their bed all the time? It's a tricky one, because you want to give them the benefit of the doubt that if it is something like arthritis, that you address those situations. So I will very seldomly bring these topics up in an animal that I can feel has got sore joints and has not yet had the benefit of pain relief and management and so on. So I'll often say to them, look, there is a significant difference here in terms of behavior and quality of life, but let's give him a week's worth of some meds and see if there's a significant change. If there is, great. Then we know that it's something that we can treat, and we can get, if he's got good quality of life, then it's worth persevering.
But also allows owners to come to terms with.
Yes. But if those meds make no difference, then that's the decision made for me. And as you say, it often just gives them a little bit more time to kind of come to terms with the idea.
Absolutely. So how do you support your clients through obviously euthanasia is we try and provide a longer consultation period.
Yes,
What are the things that you do? Because I know that you are very compassionate.
Thank you. I do try. I feel like it's such an important aspect of the job, something I don't enjoy, but I feel it's important to support the animal as much as the owner as we can.
And often you've
situations.
got a relationship
a
with
vested interest in the people and the
so it's
animal.
hard on you as a professional.
Yeah, absolutely, it is. But we do try and, as you say, give them enough time. So often if I see a sick animal, it kind of comes back to what we were talking about earlier. I see a sick animal and I'm like, okay, I can't make this decision for you, but this is what I'm seeing. We are battling here, and we're not going to get to come to the other side. And in fact, one of the analogies I often use is I say to people, if I can say to you that the next week is going to be terrible, but at the end of that week, we've got a good prognosis and good quality of life, then it's worth having this terrible week for you and the pet and us and everybody. Then you just power through it. But if we admit the animal and we put on a drip and, like, say, end-stage renal failure,
just buying some time.
We're just buying a little bit of time, but at the end of it, we're not fixing anything. Then that's not fair. So I say to them, if we are not going to change the long-term outcome, then we have to question why we're doing it in the first place. I think it's so important to distinguish between living and existing. And I think a lot of the time these old animals are just existing, and that's not fair.
No, they're in severe discomfort, and like you said, they're very good at hiding that. So
they are.
You've got to take
amazing.
that into consideration, that they're not probably displaying the full impact of their disease state.
Yes, and I think also it's a tricky one, because euthanasia it's a luxury that we have, but it's also an obligation. So, obviously in the human aspect, it's not readily available, and I think it's something that, we care for these animals, and if we can alleviate that suffering, we should.
That's really great. So let's wrap it up with, how do you get the most out of your vet visits? So building a relationship with your vet, how do you go about trying to form relationships with clients? Because obviously it establishes trust, it allows a good working relationship, especially when it comes down to critical matters, particularly like we're discussing sort of end-stage disease.
Yes. I think it's important to be as open and communicative as possible. So, whether it's regarding financial limitations or what your long-term plan is, I'm planning on immigrating next year, and so I want to spend as much time with this old dog as I can before then. Kind of communicating your needs and what you are wanting out of the relationship, I think, is important. And then also being quite organized, coming to the consultation and going, look, he's got an ear problem, but he's also got this and this and this and whatever, so being organized in your thought processes.
Sort of in planning your visits.
Planning ahead. And also, it sounds strange, but not talking about an animal that's not there. Because, we're trying to focus on this patient in front of us. So it's best not to hear about Fifi at home's.
That's for another day.
Yeah, that's another story. So let's focus on the animal that's here. So, try and be organized ahead of time, and then, focus on the animal that's in the room and communicate what you would like to get out of
Your expectations from it.
this visit.
And
you know.
limitations in terms of financials. So that
Exactly.
you can try and meet what their needs are. Oh, that's great. Thank you, Dr. Nicky, for your time and for all your informative information. It's been a really great session.
Thank you for having me.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Paws and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Paws and Effect podcast. But wait, that's not all. The Paws and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Paws and Effect podcast, please contact me at drkara@pawsandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Paws and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.